You may not know about it until you've had it, and if you've had it, you'll definitely know about it. It's called epididymitis. What is it? Why does it happen? And most importantly, how can you treat it naturally and effectively? So epididymitis is the inflammation of the epididymis, a coiled tube just at the back of the testicle that stores and carries sperm. When it gets inflamed, it can cause pain, swelling and discomfort in the testicular scrotum, and sometimes the pain can radiate elsewhere and cause nausea. Aren't you happy we started with this one today? It can affect any men of any age, but it's most common between the ages of 19 and 35, so younger men, listen up. If you're wondering what to look out for, then the common symptoms include pain and tenderness in one testicle. Usually there is swelling in the scrotum and it can be painful to urinate with a frequent urge to pee, and there can be discharge from the penis as well, especially if the epididymitis is caused by an STI. There will also be pain during intercourse for obvious reasons and pain during ejaculation. And there can be fever and chills with your immune system starting to fight the residual infection. You can feel heaviness in the testicle as well. Now, the number one cause for epididymitis is infection. Now, normally it is sexually transmitted infections like chlamydia or gonorrhea, which are common in sexually active men, but not always. And urinary tract infections are more common in older men with prostate issues. Now, other bacteria like E. coli can also be culprits, but not all cases are infectious in origin. It could be trauma or an injury to the groin or the testicle, which is a big one, and especially in sports accidents. There can be chemical irritation, so irritation of the urine flowing back into the epididymis, causing epididymitis. You can suffer epididymitis from prolonged sitting, so think long journey truck drivers and desk jobs that can also make things worse. So what can you do at home for immediate relief? Well, first and foremost, rest and avoid any heavy lifting or any strenuous activity where there's going to be straining down in the pelvic area. You want to use supportive underwear or an athletic supporter to help ease the discomfort, and ice packs for about 15 to 20 minutes in the groin can be really helpful to just move the inflammation and reduce the swelling there. Turmeric and ginger can help with the pain. I also use a herb called anemone pulsatilla for this. And then nutrition, you want to try and take anti-inflammatory food, so high doses of turmeric, leafy greens and berries, and probiotics such as yogurt, kefir and fermented foods to help try and rebalance the microbiome in and around the testicle. And then zinc-rich foods, so I talk about pumpkin seeds a lot. Nuts, seafood, immune support are all wonderful here. And you want to stay hydrated, drink plenty of water to flush out any potential infection in the epididymis. Now, when it comes to herbal support, we've already talked about anemone pulsatilla, but echinacea reduces inflammation. Golden seal is an antibacterial, especially for the urinary tract, and Uva ursi supports urinary health. Saw palmetto can help reduce the inflammation and support prostate health. And then the wonderful anemone pulsatilla. But it is important to avoid that one if you have gastrointestinal issues. You can use it topically if that would be to alleviate any symptoms you have in the gut. And then Thuja occidentalis is a lymphatic herb. It's antimicrobial, antifungal, and it can be used topically on the scrotum to try and reduce the inflammation there. Stress weakens your immune system, so relaxation is key, and you want to try deep breathing or meditation to help support your recovery. You do want to see a doctor about this. If you have severe or persistent pain, if you have suffered a twisted scrotum, or if your symptoms are worsening, the fever and the chills or the nausea is getting worse, if there is ongoing discharge or blood in the urine or semen, then do not wait. Get checked out by a healthcare provider because that could be an urgent matter. You might need some antibiotics, some pain relief, or tests done, such as urine tests, STI screening, or an ultrasound to confirm the cause. So just some prevention tips. Practice safe sex. Avoid strain in the groin, so heavy lifting, long periods of sitting, and you want to stay hydrated and maintain good genital hygiene. Now, epididymitis is treatable. I've treated it a number of times now, but it's often from the results of infections or physical strains, so rest is absolutely key. If you'd like some tailored advice, do consult a healthcare practitioner or a medical herbalist specializing in men's health. And if you find this episode useful, then do hit like and subscribe and drop any questions you may have in the comments or email me directly. Stay healthy, stay informed, and I'll see you next time in the Men's Health Hub.